Hey everybody, my name is Dr. John Birch, and so I've gotten a lot of great feedback over some of the information I've already put out on this metatarsalgia page, and I just wanted to give some simple exercises, a little bit more information about metatarsalgia, and just some simple stretches, and the whole point of therapy for metatarsalgia and why you need uh, tarsal pad and just everything else like that. Okay, and so metatarsalgia, if you guys are very familiar with it, which you are, is a very painful condition where basically every step you take, you can have some sort of foot pain, which really stinks because us people, we have to move. We usually have to go places. And so being in pain for that long, for every step you take is just, it's unbearable. You can't live life through that. And so here's some tips and tricks that help out with some of that pain and some of that issues. And so one big thing with metatarsalgia is we gotta reduce some of the inflammation going on in that foot. To reduce the inflammation, one of the easiest and best ways to do it is just by freezing a water bottle and then taking it out of the freezer and just rubbing it up and down on the bottom of the foot. That's gonna do two different things. It's gonna be a little bit of foam rolling for the foot, which is gonna reduce some of the muscle tension and create some compression to reduce any trigger points in those intrinsic foot muscles. But two, it's gonna act as icing it, which is gonna reduce some of the inflammation. It's gonna reduce some of the pain, okay? Another thing that people really need to do to start working on their metatarsalgia and start strengthening those intrinsic foot muscles is just by grabbing things with their toes. Sadly, in the office here, I don't have any marbles or a bunch of small little things I can pick up, but I'm just gonna use this simple pen to show you what I mean. The main reason you wanna use marbles is so you can pick up multiple and just set them to the side. When you're doing this, it's gonna cause the foot to have to grip like your hand, which is going to cause it to start strengthening itself and start doing the right rehab exercises that it needs to do for that foot. And so, like I said, you can use little marbles is usually the best. Go pick it up with that foot, take it over and drop it off. Pick it up, take it over and drop it off, okay? I'll use this pen. We'll see how good I am. Oh, can't do it that good with this sock. Can't pick it up nor drop it off. So you're gonna need to have your sock off and you're gonna have to have something small enough to where you can grip with your toes, okay? That's gonna be huge in generating that intrinsic foot muscle. Another thing I want you guys to start working on whenever you're just walking or standing at the grocery store is trying to create that tripod, okay? So the foot tripod is created by the big toe and the pinky toe, and then you have the heel as the base of the tripod. All right, the tripod and the triangle is one of the most stable forms and stable structures in all of nature, and that's why we have it for our foot. And so every time you're walking or standing there, make sure that the pinky toe is on the ground. Make sure that the big toe is on the ground. Make sure that heel is on the ground, because that's gonna help create that arch, and then also it's gonna help increase those intrinsic muscles, all right? One of the last things that really do help patients out with metatarsalgia, patients with plantar fasciitis, and just general foot and lower foot extremity issues is gonna be eccentric exercises. So eccentric means we're elongating the tendon. You have to load the tendon and do an eccentric exercise or else that tendon won't heal, okay? So if you're doing this, please do it on the stairs. Please do it where there's a rail or something there or somebody there to help you out. Don't just do it like I'm doing it in the office, all right? And so what you do is you go find your step. So my step is this green little stool. With the eccentric exercises, the main thing is you want that foot to be lower than parallel, because then you're really straining and stretching that tendon, okay? And so I'm just gonna do a few sets for you. We're gonna have both our feet on the stairs. You go up with one, and then you come down with the other foot. Always come down and go past parallel so you're straining that tendon. Then you go up with two, and then you come down with one. So the main reason is we gotta strain, and stretch that tendon out, okay? So with all these exercises, whether it's picking up marbles or some small things off the floor and moving them. You can only go to your body's extent, okay? So if you start getting sore, tenderness with it, take a step back. We expect soreness and tenderness because we're loading a joint or an area that's having some issues. So expect that to happen, but then ice it after you're done with the exercises. But we have to do this on a daily basis because repetition is the father of learning. It's gonna take some time for those muscles to get stronger. It's gonna take some time for that tripod, for your body to adapt to the tripod, and so you can do it. It's gonna take some time for you to be able to even do 10 reps of this eccentric exercise, but we just gotta implement it into our lifestyle. If you implement just a couple minutes of this a day, you will steadily notice improvements. It's the little things that make the biggest difference in the long run. And so please comment on this. Ask me any question you want to. Let me dig in a little bit deeper. I'm only gonna be doing one video for you guys a week. So comment on this video and like other people's comments, because that's gonna let me know what questions need to be answered a little bit more, what exercises we need to dig in a little bit more, and what information I need to provide to you out there. As you might know, I am a doctor, but this is not diagnostic. This is not a treatment. Always go to your primary care, a physical therapist, a chiropractor, and talk to them about some of these exercises and activities to see if it's the right thing for you. In the video, it's a lot easier for me to say these things than you be in the office and for me to evaluate you. And so always get evaluated. Please let me know if you have any questions, comments, and thank you guys for listening.